Perfect.
What do you remember about your high school chemistry class?
High school chemistry. I remember that it was something totally different than I had ever experienced before. First of all, I remember that I had to memorize the periodic table, and so that was very challenging. That's the first thing that I remember. Another thing I remember was how horrible I was at first, because in class we had to make, we were making acetaminophen. What we were doing, we had certain chemicals, and it was supposed to come out to a white powder, and mine came out brown, and everybody was just laughing, right? And then when I went to college, and I told them I was majoring in chemistry and biochemistry, some of my classmates just thought I was joking and thought it was, no, you're not going to do that. And so that's what I remember, basically memorizing the periodic table, and number two, that experiment that I had that didn't turn out right.
What got you interested in the medical field?
Oh, medical field. Well, initially it was because I was around it growing up. My mother went back to school when I was about, I'd say about 10 or 11 years old. And she went back for a second career. And that career was nursing. And so I remember 9 and 10 years old coming home and seeing my mom with her study groups and also the medical books that were out. I saw her practicing with her blood pressure monitor as well as her stethoscope. And so that kind of just grew on me, just seeing those things. And then when I went to school, I did better with math and science than I did with any other subjects. And I think accompanied with wanting to really help people, I thought that was a good combination. So that's how I became interested in the medical field.
How often do you use chemistry in your daily work while working with patients and leading them to a healthier lifestyle?
You know, I use it quite often. For example, as a psychiatrist, one of the things that I do is, number one, I'm sending labs off a lot. For example, if someone's on lithium, I have to get a lithium level. And that lithium level that you send them to get is based on chemistry, because it has to be, you have to measure a concentration within a certain amount of serum. Also, when I treat people for drug addiction too. And so one of the things that chemistry is important for is when individuals need to do drug tests. The urinalysis that they take, and we can test for different drugs in their urine like cocaine, marijuana, opiates, and those things is definitely chemistry. And then you think about the interactions that I do. I have to watch for the chemical and biochemical interactions between the medications that I'm given. So when I write a medication, I have to kind of know what the interaction may be between another medication. For example, some medications are binded on proteins within the blood. And if you give another type of medication, sometimes it would knock it off of that binding, causing problems. So the chemical interactions and the biochemical interactions between prescribing of medications is extremely important. It's something that you have to know as a physician.
How many chemistry courses were you required to take during high school, college, and medical school in order to become a psychiatrist?
Oh, wow. Well, chemistry in high school, I took 2. I don't know if I was required to take 2, but I took 2. And undergraduate, I went to North Carolina State in 1989. And there, I majored in biochemistry and chemistry. So I took organic chemistry 1, organic chemistry 2. They have what they call quantitative and analytical chemistry. They have some general chemistry, and then there's some advanced chemistry courses that you have to take also. In addition to that, I had to take biochemistry. Now, biochemistry is like chemistry, it really is, but instead of it being the interaction between like chemicals themselves, what it is the interaction between biology and chemistry. So example, how is it that your cell can survive in your body's pH? Or how is it when you eat a piece of toast, how is it broken down? The biological properties and the chemical properties in which it's broken down to in order to feed your body. So I took a lot of those courses too in order to major in biochemistry, but I think it was about 5 or 6 biochemistry courses.
How does chemistry impact your decision to prescribe medicine to certain patients?
Yes, so just to repeat that, for example, a patient may be on a certain medication, and as a result, I may prescribe less of that medication or more. For example, some medications may inhibit the release of the medicine. In other words, if you give two medications, medication A and medication B, sometimes if you're on that medication A and you give medication B, it will decrease the amount in the bloodstream of medication A. So you can see how that can be problematic if medication A is maybe like a seizure medication that's preventing a person from having a seizure, and you give medication B and the seizure medication decreases and the person has a seizure. So I have to recognize the interaction between those medications. Also, there are some medications that you can give, like if you have A and B, if you're already on A and you give B, then this B medication will raise the level of medication A, and they may go into having toxicity. That means too much of the medication in the blood, and they can get sick. So you have to know what these interactions are and what your patient is taking, and all that is based on chemistry and biochemistry in order to do my job very well as a psychiatrist.
How do you think chemistry will impact the field of medicine in the future?
The entire field of medicine or psychiatry in general? Just the entire field? Yeah, I think right now what you will see in the entire field of medicine is really what they're really working on right now. And it's already mapped out, the human genome. In other words, you ever heard of that? The human genome? And what's that allowing us to do is really see the differences in genetics between people. I think that in the future, you may have drugs that are based on a person's genetic makeup. In other words, you may be able to design a medication for someone who has a genetic makeup that consists of this versus someone else in that. So I think in the future, we'll be able to tailor medications more effectively for individual genetic types instead of just humans between males and females sometimes.
How important is nomenclature and naming compounds in your daily work?
I think it's very important. I don't have to name them, but a lot of our generic medications, there are chemical names. Let me give you an example. Let's say the medication Zyprexa, that's the brand name. You've probably seen the commercial on TV, Zyprexa. The chemical nomenclature is olanzapine. And there's another medication called clozapine. So it helps me by knowing what the generic name is or the chemical name, that these two medications are related. And as a result of them being related, I know they have similar side effects. So both of those medications, clozapine and olanzapine, they both cause weight gain in people. They both can cause an increased risk of diabetes in individuals. And so by knowing what the chemical nomenclature is, it helps me identify if two medications may possibly work similarly.
What kinds of things do you have to consider before you prescribe medicines or medications?
Oh, a lot of different things. For example, when I initially start to prescribe a medication, what I'm considering is, number one, has the patient responded to any medications in the past? Let's say if we're treating someone for depression, number one, have they responded to medications in the past? If so, what it was. Number two, what are the potential side effects of that medication? For example, there are some medications that make you perhaps grow a little hair on your chin. And so that's not good for women, is it? So they wouldn't like that at all. And there are some medications that may cause weight gain. And no one likes that, but women hate that. There are other medications, for example, that may cause, what's the one I was thinking about? The side effect that's common. So we got weight. Well, another medication may cause an individual to have increased heart rate. If they already have underlying heart problems, then that may be issues. So, example, well, the reason, so I really consider what the side effects are of the medication and whether it's tolerable for that particular person. So, number one is, have they been on the medication before? Number two, the side effects. But the most important thing is how effective the medication is, right? Because if the medication, you don't care whether, you don't care that the medication doesn't give you any side effects if it doesn't work. So the most important thing is finding something that's very effective for you.
Are you happy with the career you chose now that you're a psychiatrist?
Oh yeah, I'm very, very, very extremely happy because number one, it's a job where I get to find out things about people that other doctors don't. Other doctors don't ask about your mother and your father, you know, when did they get married and how long have they been married, and all these dynamics that help make people's lives rich. Like, my father may be from Cuba and my mother may be from Jamaica, and I have 3 siblings and I'm close with my siblings. And so all those things make up psychiatry, the interactions that people have and the experiences that they have. When I did other parts of medicine, like, and we need those people in family medicine and internal medicine, like gastroenterology when you get a stomach problem, or we need cancer specialists. But I'm happy for myself because of the fact that I get to hear people's confidential information. They trust us and they trust me, and to be able to see how rich their lives have been and how certain things have affected their lives. And it's beautiful because, for example, with, you think about, for like, if a person has pneumonia, there's really only 2 or 3 medications that may work for that person. It's only 2 or 3 treatments. For example, if you want to prevent the flu, you take a flu shot. But with psychiatry, it's a little bit different. Based upon the person and their experiences, then the treatment may be a little bit different. So I'm excited and glad that if I had to do it all over again, I would do the same thing.
How have advances in the field of chemistry impacted the scientific or the psychiatric field?
Oh yeah, that's a great question. Right now, what's happening is that we have this study of what we call the cytochrome P450 system. In other words, our bodies, once we take a medication, our bodies actually break it down a certain way so that it will be used. Well, everybody's body is pretty much different. They respond to different medications differently. And so based upon their what we call cytochrome P450 system, but now we have a way of doing a test on you. It's just come out in the past year or 2 where I can see what cytochrome, how you, in other words, how you may metabolize a certain medication. For example, you may be what we call a slow metabolizer. In other words, for a certain medication. Let's say if you're taking a medication, Lexapro, you've probably seen the commercials for depression. Your cytochrome P450 system may break it down very slowly, and the levels stay high in your blood, and you don't need a high dose. With someone else, so I may start them very low at 10 milligrams. With someone else, their cytochrome 450 system chews it up real fast and spits it out into the urine. And as a result, you may need a higher dose. And so it kind of takes the guesswork out of it when you have this chemical technology to help you to prepare to treat your patients.
That's awesome. Thank you.
Well, you're quite welcome.